So good afternoon, everybody. And I'm very happy that today we have our dear guest, Vaidya, Dr. Sujai Krishnan, and he is a Ayurvedic doctor and expert in Marma therapy. And as you know already, we have tradition of these webinars with the greatest experts in different fields of Ayurveda and yoga. And just I would like to introduce Dr. Sujai with few words about him. And Dr. Sujai Krishnan, he completed graduation in 2005 from the Chennai in India about education for Ayurvedic Dr. Vaidya. And he is specialized in Marma Chikitsa and Kalari massage from traditional gurus in Kerala. As you know, the seat of that knowledge is Kerala, and it's a great privilege to have some authentic representative of that knowledge with us today. And since 2010, he's working as a Vaidya in Germany, in Maharishi Ayurveda Clinic in Münninghausen, Geseke, there for many years, and also helping people with Marma knowledge and giving advice on healthy food and routines for prevention and maintaining health. And also according to their constitution, the dosha situation and the climate conditions. And he was giving Ayurveda consultations and pulse diagnosis on Ayurveda Day celebration 2021 in European Ayurveda Congress, which was held in Indian Embassy in Berlin, also on 2022. So on behalf of the Office of the Ministry of Ayush, I greet everyone here, and on behalf of ICCR and Indian Ambassador, His Excellency Raj Kumar Srivastava, we are greeting our dear guest, and please, Dr. Sujai, you can give us your knowledge presentation.
Okay, thank you, Yatranguji, for introduction. So I am living since 2010 in Germany, and actually nowadays I'm using only German language, not so much English, but I will try to continue my English language because of less. Yeah, I am using very less. Yeah. So I will start with my presentation. Then, first of all, I will share my screen. Oh, sorry, it's something. Wait. How to share screen? So.
Yes, it is visible.
It is visible. Okay,
yes.
Thank you. So the Ayurveda is a living science that believes treating the mind, body, and soul as it is the total health. Yeah, and the Marma Chikitsa also is the part of Ayurveda treatment, and it is the technique they manipulate or stimulate the Marma points. The Marma points means it is the vital energy points. It's different or several acharyas explain about Marma points in Ayurveda according to Charaga, Vagbhata, and Susruta. And Susruta Samhita. Susruta is a really good explanation given about Marma points. And he's also, we say, is the father of surgery. And Ayurveda tell about doshas. Here, first of all, how to change about Marma. Yeah. First moment. We can discuss about what is Marma. Ayurveda explained Marma is the key location of prana or energy point. That means we have Sukshma Sharira and Sthula Sharira. Thus, we say in Ayurveda, physical body and Sukshma Sharira. This is the fine or subtle body. Physical body, we will say with Ayurveda, according to Susurda, 107 Marma points. And subtle, fine energy, that is, we say soul, or that is the transcendental. That's the one Marma point. It's including, we say, 108 Marma points. And they can be used to diagnose and cure illness. They utilize to promote overall health and lifespan. Marma points are just not only anatomical point, but also a location where the tridoshas, that means Vada, Pitta, Kapha in the subtle form, that is the prana, ojas, and tejas. That Vada is the essence of form is the prana, that is the real vital energy form, and Pitta in the form of ojas, and Kapha in the form of tejas. This is all three together also present in the Marma point. So, oh, it's not moving. So, according to Marma anatomy, we say this is a joint or crossing point of muscles, vein, nerve, or ligaments, bones, or joints. That is the real sensitive point in the body. According to Susurda, we say 107 Marma points. And total we say 108 Marma point. One is the soul or mind, very fine energy point. And this transcendental Marma point. This is the main Marma point. It is situated on all 107 Marma points. This is actually working together, physical and mental. There is a difference in physical and mental Marma point is physical Marma points normally it is depending upon the body activities, they will get maybe damaged or blocked. But mentally we say transcendental Marma point, it will be normally blocked or damaged due to some stress or some shock. So there, according to Susurda, we say this Marma points get damaged. Normally, some physical, we say as physical activities like over usage of body part or some damage like accident, something happening, then it will be blocked. The treatment, but we will try to do the treatments according to the Marma technique, yeah, Marma therapy. There is a, according in Ayurveda, we will say 108 Marma, but in India, we have a lot of traditional Marma technique. That means I learned in two tradition. One is in Ayurveda, one is in Kalari. In Kalari, they have more than 370 Marma points and 72,000 nadis. And their concept is little bit different from Ayurveda, but it is almost the same because this is all connected. And Siddha, in that is also one Ayurveda, like Ayurveda in South India, in Tamil Nadu, they are practicing Siddha medicine. In Siddha, they are really well explained about the Marma. They say Varma. Yeah, this is actually very good explanation, and they say Marma point is the really subtle energy point in the body, and normally this is a Marma point. The body is signaled manufacture exactly what it needs, including hormones and all the repair in the body. Then our body and mind, when it will come together, then it is the real Marma point more active. So then just a minute. We can talk about now types of Marma. We told 170 Marma physically, and then one is transcendental Marma, including altogether we say 108 Marmas based on traumatic consequence. That means what kind of damage may happen. This is more important clinically, because some marma bigada, we say damages, yeah, that is not easily manageable according to this traumatic consequence. We classified as this is as Shalya Pranahara, that is the some spelling mistake there, sorry. And Kalandara Pranahara, Vishalyahara, and Vaigalyagara, and Rujagara. So classified, these are Marma points. This is the Shalya Pranahara Marma. This is the first one. It is a very important Marma point, because some traumatic consequence, that means some damages affecting in this Marma point, it will cause for a sudden death. So this Marma points, like we say, this three Brahat Marma, like Shiras, Hridaya, and Nabi. This is very important to know. We have to protect ourselves, but our body, it's doing it itself. And Kalandara Pranahara, some that means when this Burma point affected any damage, it can also cause for die, but it is not happening sudden death. It will be slowly, but it is normally we can manageable. That there is the big role of Marma Chigilsa, Marma therapy. And we say Vishalyakna, this is the another Marma point. Maybe it can also cause for death when we are not really treated, but normally it will make a physical damages. Then we can say Vaigalyagara, that's normally make some deformity or some sufferings maybe happening when these Marma points are damaged. Then we will say this Rujagara. That's only the very we say very light, because there is not much happening when it is damaged. Some suffering, pain. So like that it will happen. Then based on the body locations, we classified the Marma points. This is the Mamsa, Shira, Snayu, Asti, Sandhi Marmas. That first of all, I explained what is Marma point. That is the one crossing point or one junction where it will meet. This is a Mamsa, Shira, Snayu, Asti. That's the muscles, artery, vein, ligaments, bone, and joints or nerves. Yeah. This is the Marma point, and some Marma points are important for Mamsa. That means that area muscles very important. Some Marma points really important for the artery, vein, or nerve. Then Snayu Marma, that is the ligament, which is mostly connected to the joint. There is the Asti Marma. Some Marma point is connected with a like Ani and Uru Marma, like this. This is more connected with the bones, and Sandhi. This is mostly joint Marma. But it's all Marma points. It's connecting to with these muscles and artery and ligaments and veins. So we say this is the one classification. The first one according to the injury, second one based on the body location. Here I have one build, one picture with the Marma points, and we say 108 Marma point, but 107 we can see the physically. This is most of the important Marma points located on the head, then rest we can see in the thorax and upper and lower limbs. So now we can talk about the role of Marma therapy or in Marma Chikitsa. Marma Chikitsa is the one of the good technique. That means I will say this body when one blockage fine. That means the Marma point when get a blockage, then our prana energy flow will blocked. So then body will not get enough energy, then it will reason for any illness. That means we say this is a dosha balance. This is vata, pitta, kapha. When marma point blocked, then normally vata, pitta, kapha, this is dosha get also imbalanced. In marma therapy, what is the simple technique which say just manipulate this marma point? That means we use some pressure. That's why sometimes people say it is a marma point is like a pressure point, but I say it's a pressure points mostly located on the muscles and anatomy based on muscles. But in marma point, it is a really vital point. It's an energy point. Yeah, and when this block there with a manipulating this block, that means marma point, and we try to remove the blockage. That means their artery, vein, nerve we get damaged. Then there is no flow of energy. That means there is no blood circulation. There is no nerve stimulation. That make normally body stiffness or pain, inflammation. When this is a point, it's important for some organs. Then these organs also not functionally properly or properly cannot function. In this condition, we use pressure to release the blockage, but sometimes we can't use pressure. It is depending upon the condition of the blockage. Sometimes it is really vata dosha, that means really hard blocked. Sometimes it's pitta, it's inflammation we can see. Then we have to stimulate very soft, not we don't use any hard pressure. When we will see the hardness, that means when vata dosha blockage, then we will use the pressure and we will try to release the artery, vein and nerve junction. Then it will start the flow of blood. That means energy can flow. Then body try to heal themselves. Normally when really energy flow there, then body can heal itself. Actually, I will say always in my practice, I will do the only the half, rest your body healing, because depending upon your own energy, then body can really release the energy, or they will start to heal your problem. And we told about the marma are the key location of prana point. So then we say they can be used to diagnose and cure illness. That means we can use marma points to diagnose the illness, and the same marma points we are using for the cure the illness. Mostly I do pulse diagnosis. Then with the pulse, we will try to find how is the doshas. That means we say the Vata, Pitta, Kapha, but again 5 types of Vata, Pitta, Kapha. That means Prana, Udana, Samana, Apana, Vyana. So according to which dosha damages. For example, I will say when we see and one Pranavada imbalance, mostly the Krigadika Marma, Atlas is blocked. Treatment mostly based on the symptoms. That means when Atlas blocked, I will say normally the people get headache or restlessness, and that shows the how deep blocked. Sometimes it is only the restlessness. Normally the blockage is not so hard, but when sleep also disturbed, then it is blockage is hard. That means maybe hard or chronic blockage. And same like this, sometimes we can see the Apana Vata. That's the important place for lower back, and in that stage I will treat mostly very soft, because London as a lumbar vertebra area, mostly a very sensitive body part, and normally with the treatment it will get stimulated and energy flow is there, then body itself started to treat. And so here also some problem. Then normally Marma Chikitsa, but we say it is helping for developing our mental and emotional ability also. That means if one Marma point blocked, then it will start mental and physical problem. Mostly our subtle Marma point, the transcendental Marma point get blocked, then we will get also a little bit restlessness. There we will see because of the pain, sometimes we will get problems, sometimes we will not have not that much problem. Yeah. And it is the, I told it is the location where it's the Tridosha and subtle form of Prana, Ojas and Tejas. Yeah. This is the important thing in Marma Chikitsa, because if we don't treat properly, then it will damage the subtle energy part. That means not only physically, and is our fine energy. This is very important. Is the fine energy is the real energy to stimulate the physical energy. And when this a blockage freeze, then normally it will get healed body itself. And one more thing. Yeah, and normally with the Marma Chikitsa, we can develop our immune system. That means body started to flow complete energy. When it is blocked, then complete energy flow not there. And there is one of the good technique is pranayama that I will suggest all of my patients, because pranayama is the one of the best method to stimulate the fine energy in Marma points. Normally, yoga in Surya Namaskara, sun salutation. This is the one of the another technique I will recommend for stimulate all 108 Marma points. But pranayama, it will help to bring really the fine energy to the body. Then what is the next? Oh, it's finished. Minute. Oh, sorry. Oh, I can't display one more. Sorry, but just a minute. Okay, one slide not working. Then I would like to talk about how our body protect our Marma points. Most of the Marma points, bodies self-protected. And for example, I will say when there is a stone in our foot, feet sole, that's the Marma point for Talahridaya. Talahridaya means Tala means head, Hridaya means heart. That's very important for uh, circulatory system and nervous system. There is something irritated, then mostly we can't concentrate any other things. Then body always Marma point protected, and any pressure on this, then we are feeling uncomfortable. Body itself, they can protect Marma points. Then normally what we must do for protect our Marma point is like that I said, pranayama, it's really good, and yoga, it will helping, and ahara vihara, it's also important, because good diet and good activities, it is important for Marma protection. And it is the next one is the nidra, we need proper sleep. If we don't sleep properly, then Marma points mostly active, the pitta say too active. Then also one cause for the pitta damage, yeah. Then what? Yeah. Moment. This is my. It's not working. Sorry. Okay. Stop sharing. Okay, Yetranguji.
Yes.
Actually, maybe we can start a discussion. Then it is more easy, because
Yes, yes.
I have one more PowerPoint. It is not working.
No problem. Yes. Yes. Because it's good that we have time more for discussion. Some can have concrete questions, because today there are many different methods of treating the vital points on the body. As we know, in osteopathy, they have also shiatsu in Japan, and then acupressure or acupuncture in China, then Bowen method and Feldenkrais method, and so chiropractic method. And we know that all knowledge comes from India and from the tradition from Kerala. That knowledge came by Bodhidharma to the China, and from there spread further. So maybe you can say from your experience in Kerala, what is the process of learning and of
Kalari and Marma technique.
yes. What was your experience?
In Kalari, they are learning this Marma point as a really very sensitive point, or it is part of the martial art also. Yeah, that means it is very important to protect self-protection, and same time in olden times it may use to what we'll say in English. Yeah, it's like war. Yeah, when one problem there, then people can attack on the Marma point, and it will try to damage it. And there is importance of Kalari Marma Chikilsa. That means all this martial arts can damage Marma points. Then what we are doing normally, most of the in Kerala, I can say, I also studied under one guru. They have their own tradition, and they try to follow this tradition. and they are also expert in some kind of Marma therapy. Not all problem. Some expert in, mostly they are expert in joint and physical damages to treat. There I learned mostly the problem with a disc prolapse. It is they are managing very easily, and fractures, joint damages, bone fractures, and they have, or we have also their own preparations. They make some herbal oils or herbal powder or fresh herbal paste. This is actually really good preparation, but most of the family, they are keeping their tradition, or they like them Marma, they say it is the secret of art, or very special. What do you say? Their, yeah, they try to keep their secret, yeah. And nowadays it is they are more open, and like that I also got a chance to learn. Then it is really helpful to practice, because Marma theory and practice, it is little bit different in my experience, I can say, because depending upon the person who have really good energy and some severe blockage, it is no problem how severe this blockage, their own body or their own energy can heal it properly. But if somebody get a blockage with a low energy, then it is normal. It is difficult to treat. With my experience, I can say. And in Kerala, we try to treat most of the people the same way, but it is not in the same procedure. Mostly, we are using a different technique for treatments, but it is a really good experience, and I have also so much good experience to treat with the Marma therapy, because in modern science, some problems they can't find what is the reason. There is the our Sukshma Marma, we say this, the real fine energy, subtle energy point. Yeah, there is the blockage that we can't see it in physical level. There, I had a lot of good experience to treat the people, and they're, yeah, they're so happy after that. And what I could say about Kalari Marma and Ayurveda, actually the Kalari Marma, little bit we say they can do good practice, but they are sometimes, I will say, they need also more knowledge. That's my experience, I will say. It is good technique, but sometimes we must know about the anatomy and physiology of the body. Then we can treat easily. This is my experience. And normally it is the Marma points. It is we say 107, but actually more than 107 points are there. It is a very fine point, and this 107 point, we say the but physically the main Marma point. This as mostly the fine points are showing the symptoms. With my experience, I can say. So
yes, and the way how you locate the position of the Marma points, there are this ancient measure angula, which some people are mixing with inch, but angula is that ancient measure by which they described the position of the Marma point. So practically, how you do the measurement with the angula?
This is the measurement. We say the yeah, no, it is like inch, or we say angula pramana with the finger measurement. Yeah, we can feel the finger measurement, but I will say it is depending upon the person. That means it my fingers, it is perfect for my marma point measurement. Yeah, but someone will come, then I have to look their angula. That's
Yes.
their fingers.
So you use their finger for measuring.
I will watch it
Yeah.
definitely because this is important.
Mm.
And before marma therapy, I always do pulse diagnosis. During pulse diagnosis, I will get their body type, their vata type or pitta or kapha pitta or so. Yeah.
Mm.
When one pitta type person there, naturally their angula fingers are medium in size. And when kapha person, it is actually more dominated bones and joints. Yeah. Like that vata persons normally very thin and light. So marma points also I feel it same way, how the size, and it is maybe small and bigger. Yeah, but mostly what I do in my practice to find the marma point on the up, upper limb or lower limb or chest, that's the we have both side the same marma point. Then we can one time we can we say I will try with the both side of body. Then I can find it how big and how damaged. This a good marma point is stay in good in shape. But which one damaged, there I can say how deeply damaged. But angula pramana is a good technique, but mostly I will say in my practical life or clinical experience, I have to look their pulse and their type. Then I can really come to the my conclusion how bigger and how bright this marma point.
Thank you. So please, everybody who is participating, if you have any question to ask.
I have a question, Maya.
Yes,
Yeah,
you can put your
you can.
camera
Video?
on if you like. Yes.
Okay, just to see where I am, because I just came back from kindergarten to collect my kiddo and immediately sat down because I was very excited to see firstly you, Jadranko, as my mentor. Hello, long time no see. And to hear, of course, you know, like all the story about marmas and everything. So hello, and congratulations on mixing, I mean, on keeping like 3 languages together, like German and English and Sanskrit, you know, like expressing what you want to express. I mean, this is really fascinating, you know. So my
Thank
question, yeah, you're welcome, you're welcome. So my question is like I know that I'm Vata Pitta type, and how is there any way to scan myself like fastly? I do yoga every morning. Yesterday I've started with TM after, I mean, I was waiting for it for a long time.
Yeah.
So is there any way, I don't know, to prevent, I mean, even doing yoga every day, you know, like also working with some, I'm working with one pregnant friend and her mother who has like, I mean, very broken joints because she's like working with machines all her life.
Mm.
And so is there any way like to prevent all these damages according to our dosha type?
Yeah, it's actually I can say it's Marma points and dosha type. It is not really important because every type people have Marma points, yeah, and
Sure.
according to the dosha type, some points we have strong, some Marma points we have weak Marma points, yeah. This is
Okay.
the difference because nobody have 108 points really healthy and strong, full energy. Okay,
Yeah.
most of the people have a lot of weak points, but in our daily life we don't feel it. This is there is a weak point. When get a blockage, then only we can feel it. This Marma point get blocked, then body shows the symptom. But if they are weak, then body don't show the symptoms. Mostly I will say how we can find our weak Marma points. It is only through the over what you say over usage. That means, for example, I can say if you are going for a walking every day 5 kilometer, one day you went for 8 kilometer, then your for example your right knee shows little bit pain, but left knee have no problems. Yeah, that shows right knee little bit weaker than left one. Then in this way we can treat or we can try to develop our energy on right knee. There is a lot of yoga postures there. Then we can try to stimulate the Marma point. When each time we stimulate, then a lot of energy, that means blood circulation is going, then body try to develop this Marma point. But some physical exercise also important. That is depending upon the pulse. Mostly I can say is I can say how for the Vata Pitta tube, yeah, is Vata type or Pitta type or Kapha type. It is general, but according to the pulse, it particularly it shows which Vata or which Pitta or which Kapha. Yeah, it is getting weak. For example, I see okay, Vyana Vada, it is weak. Then I will say okay, you have to take care of your joints. Yeah, and if I will say Sadhaka Pitta, then I will say also the Brahit Marma, that is the Marma point in between the scapular region, that is the thorax, in between 5 and 8. These Marma points are important to protect.
Okay.
Yeah. And Vata Pitta type, mostly it is important, or all the type people can protect their Marma with a Abhyanga, self Abhyanga. Yeah. Yeah, self Abhyanga always stimulate all the Marma points. It's the Abhyanga, it is not only the massage, it is stimulating the all Marma points. And when there is a Marma point blocked, then we can feel it. When we uh, do the massage, then this is the flow, we can see something disturbing. That's mostly a small blockage there. But when there is a real pain, then it is a real damage.
I understand. Yeah.
And for excuse me, you told you are Pitta Vata type.
Vata Pitta.
Vata Pitta type, yeah. Of course, in Vata Pitta type, yeah, you can use oil application, especially I will say in the joints and your abdomen. That means in the front, Nabi Marma, and the Abanavada, that is the Marma points in the Parsha Sandhi. It's the lumbar region and your hip area. This is the mostly a very sensitive part according to your type. But with the pulse, I can say more clearly.
Yeah. Cool, cool. A lot of friends that I know, they practice yoga basically and everything, and they're like the same type as me. We have, oh really, you have this pain here, you have this like lombatic, like
Yeah,
it's like unbelievable that all of us have the same symptoms and all of us have these like really weak parts. Yeah, definitely. And about the food, now is the season of like fresh vegetables and fruits, and it's well known that we as Vata Pitta, we are not really invited to eat fresh cucumber, for example, and everything because of digestion and stuff. What should we do? We should keep continuing like eating cooked food, cooked meals, or just go for fresh one.
Yeah, this is actually good. You have to eat more cooked and warm food because of your vata pitta. Mostly, this vata can make an imbalance on pitta, renjaka pitta. And I told it's mostly the lumbar area. That's the thorax 11. There is a one marma point. It is important for the digestive system. Yeah, then it is always sensitive. If you get more, what you say, it is, yeah, more exhausted, yeah, then it will get blocked. Then normally your digestion is very sensitive area, but you can manage it mostly if you feel any, we say this a gas formation, air or on the stomach, yeah, then you stimulate your lower back marma points with the warm. That means this warm bottles or warm pillows, yeah, you can use it. This is the one thing, because this is the weak point, and is, I will say, in yoga is the pavana mukta asana is the one of the good technique. You can stimulate this marma point, Philae, maybe Pavana Muktasana. Yeah.
Yeah. Sure.
Yeah. This is you can practice this Pavana Muktasana as a exercise.
Yeah, well, like the primary one every day. Yeah.
Every day, and you just do it minimum 5 to 8 times continuously. Yeah.
Okay.
This is really good, helpful for stimulate the marma points on lower abdomen, and it will improve for your digestive system.
Okay.
Yeah.
Okay. Those were my question, and vielen Dank.
Yeah, vielen Dank.
So if somebody else has some question, thank you very much. Hvala, Jadranko, za uključenju.
Yeah, thank you.
I have another question.
Okay.
Yes, Dagmar.
I have the question, when a person comes with a special symptom, a Western symptoms, for example, can't close or open the eyelids, how do you come for opening the eyelids?
Yeah. Not opening the eyelid.
Not opening the eyelid.
Okay.
And how do you come from this symptom to the mama point? What is your way?
Normally, it is not opening the eyelid. There is many or 3 options according to the Vata, Pitta, Kapha symptoms. When Kapha damage, it is already, we say it is what we'll say, it is difficult to move, and in Pitta we will see some inflammation, and in Vata it is really a blockage. Yeah. And what we'll do in Marma therapy, mostly I have the picture maybe here. Moment. Oh, Just a minute. Get it? Dr. Dagmar, you can see.
No, I see myself.
Wait just a minute.
You need to share screen.
I need to share screen. Okay,
Yes.
I forgot it. Yeah.
Yes,
Now.
and then
Wait. Something is not correct.
No, I see the picture from the.
Yeah.
Yeah, that's it.
Okay. Here we will see the Marma. Normally, I diagnose with a pulse diagnosis, but mostly in not opening the eyelid, we have the Apanga and Sanga Marmas. Yeah, that must be stimulated, and Sanga Marmas also must be stimulated. Then it will help if any blockage. Mostly the blockage we say this is ama. Then it will release. Then it will help to first of all for good blood circulation.
Okay.
Then we will stimulate minimum once in 2 hours. Self-stimulation, it is important. Yeah. And what is the diagnosis actually for this?
No, it was just an example coming from a special symptom, the Western symptom, to the Marma point. It was not a concrete question. It was just like, how do you go from a Western symptom to your traditional system?
Yeah, mostly for this question, I will do treatment for the all Marma point from neck, stimulated. Atlas, yeah, Vidura, all this Marma point, Shanga, then it will all the Marma points on the heads. That is the all together we say the Shira Marmas. Yeah.
So you go to the area, to the area where it's located, the problem.
Yeah. Then all the Marma point really awake. Then we will go to the exact the Marma point. What is the important for eyelid? This is the I said this is the Avarta and Ukshepa and Sanga Marma. Yeah, and Abanga also. Yeah. This will stimulate it.
Yeah. So you go to the area where you assume the damage, and then you take the Marma points from there and activate them.
Then activate.
Yeah, okay.
Because the all Marma points once activated, then it will stay for mostly with my experience, I can say another 48 hours. After 48 hours, mostly body itself slowing down. That means it become weak. But in this case, I will say mostly they can also stimulate themselves without using any pressure.
Okay.
That will help to active for longer. That means it is in sometimes this a healing process take 5 to 10 days. Then one treatment not enough. Then they must do it themselves at home. Then it will be easily manageable, I can say.
Okay.
Yeah.
Thank you very much.
Yeah, welcome. So stop sharing now. So
thank you. Yes, it's very nice questions. And please, if some other has some question, because this is very good from experience to hear how the Marma treatment is applied.
Yeah, Marma treatment mostly applied depending upon the condition of the patient. That means how their energy level and same time how strong this the blockage. It is always not the same. I will say one will come with a frozen shoulder. One can we can treat really with the power. That means a lot of pressure we can give. But in the second case, maybe I'm not allowed to give any pressure because their body already weak. Then this pressure can also make damage. Then I can do only first 1 or 2 sessions only the stimulate the Marma point and bring more energy there. It is always depending upon the patient condition. Okay.
Good. Yes, and in case if there is the person which has weakness in the nervous system, for example, the sense of touch, it's like numbness of the nerves.
Numbness of
Then
nerves,
yes, then they don't feel much. Even you make a pressure, they are not able to feel. So then you use stronger pressure to stimulate their experience of that point.
Yeah, this is actually I don't use stronger pressure on that point actually. If there is a numbness there, then first of all I must check this a numbness because of blockage or because of weakness. If there is a blockage, then I try to find which Marma point is blocked. For example, numbness on the hand, it is starting from the this Hamsa Marma, because the cervical vertebra Marma points, it's 5, 6, 7. It's very important. Yeah. If there is a damage there, then I need to treat only there. Then all the rest, the hand, the Manima, the Ani and Janu, all the Marma points get released. But if I see their weakness on this Marma points, then I can do only the stimulate. This stimulation can help to release the symptoms, and body try to bring more energy, and body itself, they can heal it. Sometimes when it's weak, then body can't they can't active. But it is depending upon the condition, this numbness treatment. It is damage, then definitely I need to use pressure. That means damage, not I means blockage, any blockage. And in weakness, mostly I told after the treatment, the patient must do some exercise, yoga postures to stimulate and active and become more energy on this Marma point. Otherwise, it will again slowly get weaker. Then we will see the symptoms later. Yeah.
Thank you.
Yeah, welcome. So any other questions?
Yes, I have another question.
Yeah.
If I practice yoga and practice, for example, a special Vayu like Udana Vayu, and do it for some months, is it possible that you feel it in your pulse diagnosis, that Udana gets stronger?
I can feel it. Naturally, this Udana gets stronger, yeah. And same time, I can feel it also, the Marma points on the shoulder, neck, and upper back, Marma points more active.
Okay.
Yeah, but mostly I can compare it if I know some months before this pulse and 3 months later, then I can really feel it. Otherwise, I will think, oh, it is really good, healthy points.
Okay.
Yeah. Okay.
Thank
Any
you.
other questions? Then
Someone else, some question?
okay, then
Hmm?
no. Okay, Etrangoji.
Yes, thank you. So thank you very
Yeah,
much.
you're welcome. Yeah, thank you, Etrangoji, for inviting. Thank you all for participants.
Yes, thank you, Dr. Sujai ji, for sharing
Yeah.
your knowledge, experience. And
Okay.
yes, because the Marma science become more and more popular these days, and especially in the western part of the world, and the proper understanding is important.
This is very important because Marma therapy we can really practice when we know how the illness, or the practitioner must know about the illness. Otherwise, I will say maybe it can also wrong happen. Yeah.
Yes,
Yeah.
yes.
I told I can tell you, if somebody coming with a knee pain and I will see there is a really a vata blockage, yeah, then I can use the pressure. The next patient also say the knee pain, but I will see the really inflammation, yeah. There I never use any pressure. I can only very soft touch and stimulate. But both will say knee pain. When the practitioner don't know the difference of this knee pain, then it can be a failure, this treatment.
Yes, yes, yes. It's an individual approach.
Individual approach.
Yes, this is like in yoga therapy. There is no specific now this for that. For the same health problem, two different people will have two different approaches according to their situation. So thank you very much, Dr. Sujai, and everybody for being present, and see you next time.
See you next time. Thank you.
Yes. Thank you. Bye.
Bye.